I'm happy that we get to make this an event where people can talk to each other and they can learn something interesting. We try not to waste your time, try to do it at lunch, give you food, but more importantly, give you some really, really great examples of research at Texas State. So sometimes, you know, that just makes you feel a little bit more familiar with what's going on around here. And we know it's uphill in both directions and everybody has a busy life. So it's hard to know these things otherwise. So this event is for me really, really important. And I'm grateful to Abby for continuing it with us at THRC and doing it so that we can all learn, because I learn every single time. So today we usually have 2 speakers and they're different every time and there's different themes and things. But this particular Lunch and Learn, that's what I call it. It was a no-brainer for us because we've really, really heavily invested this year in mental health research for obvious reasons, and also because, I mean, it's important, but also because I thought that we had a growing group of people who were doing some similar work that maybe were collaborating a little bit or maybe knew of each other, but didn't really fully know each other in a way that could really amplify our potential to have something that's long-term and have something that's meaningful. And I thought, in addition to our research path, which you're going to learn a little bit about today from 2 really exceptionally good scholars, I thought that we also needed to build the infrastructure to not be the university that is here today, gone tomorrow, when we go into these applied spaces. So a lot of times, you know, you get a grant, you go in, you do an intervention, you're there, the money runs out, you're like, see ya. And this has built a bad reputation for some universities. We don't want to be that university. We want to be in it for the long term. So in addition to having faculty fellows this year and a really good group, including the 2 speakers you're going to hear in a minute, which I'll talk about, and then also Megan Rogers, and I think y'all are the 3 that are here, but it's a really good group of scholars who are about to do a series that we'll say at the end. We're also concurrently running a community focus group. And after y'all wrap up, I'm going to let Cody talk about it. But the idea for me on a practical level, and this is the takeaway for y'all, if we need sites to collect data, if we need places to do interventions, if we have specific populations that we're focused on, that we don't want to grab just what's available. We want to grab the best people with the most potential to benefit the most from the good work that we do. And that doesn't always happen overnight or on a schedule. So we want to do the relationship bank, build a relationship with community organizations, and do it in a way where we're offering something before we come and ask for their letter of support for our grant. And do it in a way that's intentional, not to just make it transactional, but really to really help everybody get better in the field of mental health. And so that's what we're seeking. And so concurrently, we're running faculty fellows and supporting their work in mental health, but also working in community spaces in a variety of ways with a new training program and a whole series of a lot of things happening at the community level. So just remember, THRC is a source if you're doing research or grants, or you hear about people that are struggling, that if they need these community connections, we have a really good team that can help with that as well. So there's my ad. Our first speaker today is Jessica Perrotte. She is an NIH-funded scholar in the Department of Psychology, and followed by Clary, I think also a federally funded scholar working in mental health, and both had the similar background to me looking at their CVs. And I thought, why are these people working together? Because they're in different colleges and departments. Now they are. But they also have their own unique programs of research that you get to hear about today. So not going to take any more time. Jessica.
Oh, awesome. Okay, that's us. So I'm still an assistant professor. I'm wrapping up my last year, hopefully on the tenure track. I came to Texas State in 2019. I feel like a global pandemic in the first year of your tenure track position, I'll tell you what. So this is so Kelly and I, we've had some conversations leading up to this, so I think that we're both going to follow a pretty similar pattern with our presentations today. So first, we do want to tell you a little bit about who we are as far as the research that we do. So give you a summary of the research agenda. I know I'm going to go ahead and cover some of the major questions and some key findings that have been coming out of my lab. But what we really want to focus on today, and what was kind of communicated to us from the folks that invited us to do this, is really about our record of federal funding that we've achieved so far. So we have, we are both we're both federally funded. We both have very different styles of grants, though. So mine are going to be more mentored career development type grants. And so I want to talk to you a little bit about those. I think we're both going to want to talk to you a little bit about some tips, tricks, and takeaways. And then also I'm hoping that this will be very interactive. So what do you think of between us that we can do Q&As for each of our presentations? So please pummel us with questions if you have any. We're open books as far as a lot of this stuff goes. So. All right, so my research agenda. So in my lab at Scarab, the outcomes of interest for me are oriented towards health risk behaviors such as alcohol use, substance use, risky sexual behavior. I am interested in alcohol and substance use at the problematic level. So you might hear me talk about alcohol use or alcohol use disorder would be the term I would use. So there's a strong undercurrent of mental health underlying that, right? Like alcohol use disorder is kind of something under the mental health umbrella here. But also I'm interested in just what makes people drink in general, right? Like what is it that makes people want to drink more frequently? What is it makes people want to drink more whenever they're drinking, right? Why is it that some groups of people, right, especially people from minoritized backgrounds, why is it that when they drink the same amount of alcohol as a group from a not minoritized background, they encounter more problems, right? So these are things that I think about a lot in my research that I do, and I've been thinking about for years, like since I was an undergrad. And so overall, the research agenda that I have as a social psychologist, which is my appointment in my department, is I think a lot about environmental influences, right? I think about the ways that the social world around us provides prescriptions for how we should behave. I think a lot about gender roles, right? Like, what does it mean for me if I identify as a woman? Like, what does society say that I should do in terms of drinking? Like, what kind of signals am I getting, right? As far as the extent I should drink, the manner that I should drink, the extent I should abstain, right? How does that then contribute to the ways that I think about drinking? How does it affect my motivations, right? Am I going to be more likely to drink to cope, right? Because of like all the wine moms that I see on social media right now, right? And then how then does that in turn relate to drinking, right? So that's the first major part of my research agenda. Something that I'm very focused on, I have been ever since my pre-doctoral days too, is addressing what I see as major gaps in the literature and the work that I do, and trying to expand, enhance, recalibrate, you name it, what I consider to be the scientific tools. So I'm primarily a quantitative research psychologist. I work a lot with data, I work a lot with measures, right? And so what can we do to update measures, create new measures to better operationalize these things that we're trying to measure, because it's also limited. Something that I do want to point out, and kind of in light of Melinda's introduction, which is awesome, is that I'm not a clinician. You know, like I said, my appointment is a social psychologist, so I'm not a clinician. I am a researcher. I am interested in understanding the pathways to these behaviors. I'm interested in understanding both the risk pathways, the resilience or protective pathways to these behaviors. I'm not an interventionist. Right? I don't make intervention programs. I don't make prevention programs. I'm not thinking a lot about treatment, but what I hope to do is have the work that I'm doing, especially the cultural angles that I'm constantly thinking about and the cognitive aspect I'm constantly thinking about, to inform that work. So I kind of like this. We thought it would be good for me to go first because I'm back here, you know, and then Kelly, I think, is going to talk a little bit more about being on the ground with it, you know, so. All right, so some specific research questions, right? So as part of a current grant that I have, that I'll talk a little bit more about in a few moments, I do think about just almost like this epidemiological lean, right? So we've got all of these different heterogeneous subpopulations within the United States, right? So we have to think about people at the intersection of, at minimum, right, sexual or gender identity and ethno-racial identity, and kind of like teasing out just what are the population-based estimates of alcohol involvement among each of these groups, with the differences across groups. I'm shocked at how much you go to the population-based literature, and what you see are a bunch of studies where you have folks either collapsing across ethno-racial identity while they report about sex, or they collapse across sex while they report about ethno-racial identity. And so we don't know what Black and African American females are doing at the population level. We don't know what Hispanic or Latino men are doing at the population level, because all of that's been made into a composite, right, in the analysis. So I'm doing a lot of work on that right now. Cultural orientation, shaping the way individuals perceive alcohol misuse, and to what extent they engage in alcohol. So I do a lot of work with something called acculturation. Are you all familiar? Anybody familiar with that term? Right, so basically orienting toward or away from a mainstream host culture, and then a heritage culture, right? How does that relate to drinking? And then I spent a lot of time thinking about gender roles specifically. I kind of alluded to that, right? Gender related scripts towards drinking, like how does that affect drinking? And then here at the end, I'm actually working a lot with specific gender role measures in this area. So just some key findings. So in some of the studies where I'm looking at that population-based analyses, right, to try to disaggregate across all of these different groups, we found some interesting stuff. Now, some of these are in press, some of these are just now under review, but just some highlights here. So we are showing that from the years 2002 to 2019, I did trends analyses of a national data set, and I found that among women, and we're talking about early adults and then middle-aged adults, only Black females are increasing their frequency of drinking, right? Which is a pretty relatively new finding in the literature. So overall, if you look at, if you collapse all that literature or all the data together, you'll find that historically, Black and African American women drink less than women from other groups. But what we're seeing here is there's an uptick though, over the years of the drinking. We're also showing that among middle adults, alcohol use disorder severity is increasing among both white and males and females only. Right. And so again, if you think about composite data, you see a lot of research that shows people from minoritized ethno-racial backgrounds have higher levels of prevalence of alcohol use disorder, typically. But what you see of these trends, though, it's kind of saying something a little bit different. And then as far as my work with acculturation, some of my key findings is that among Hispanic and Latino young men, if they're pulling away from American culture, right, orienting away from that, they might actually drink more alcohol in certain contexts, depending on the drinking behavior. So this was a paper about pre-gaming, like pre-drinking, partying. And then also among Hispanic and Latino young men, orienting towards Latin American culture, or in my field is called enculturation, they might engage in more health risk behaviors, such as alcohol use and substance use. So it's two separate dimensions, orienting away from US culture, orienting more towards Latin American culture. But then, however, the flip side for Hispanic and Latino young women, orienting towards mainstream US culture. Now, past literature, not necessarily my own work, shows that that's related to more drinking, but some of my work shows that it's because they expect better things to happen when they drink alcohol, right? We're looking at alcohol expectancies in some of these papers. As far as the gender role research goes, I talk a lot in some of my other research talks. I'm not going to, I know that Dr. Rogers here has heard it, but I talk about this traditional gender role hypothesis that's like way oversimplified in the acculturation literature, which basically says that men are culturally prescribed via masculine gender roles to drink alcohol, and women are culturally prescribed via traditional feminine gender roles to not, right, or to refrain from drinking. Well, my research so far shows, I don't know, it depends, right? Not really. It depends on the level of stress that they're feeling. So for some folks, when they're higher stress, some of their gender roles might actually interact with that so that they drink more alcohol. It depends on the dimension, right? So for masculinity, I think there's a problem that we have with discussing masculinity as far as like a cultural and gender like deficit, right? But there's a set of prescriptions that are positive, set of prescriptions that are negative. Yeah, okay, so some maladaptive masculinity is related to more drinking. But guess what I'm finding in my research is that young men endorse caviarismo for Hispanic and Latino men way more than this traditional machismo. Like that's always way higher. And caviarismo is related to less drinking. right? So there are these protective aspects in masculinity. So it's like, I don't know. It's not that simple. And then the domain of gender roles being measured. So basically, are we talking about the attitudes? Like to you, is it about something that you think, for me, right? This is what I think a woman should do, right? So I have this set of prescriptions or this script, but then to what extent do I actually do that, right? That's different. Like those are the general behaviors versus the beliefs. And so last research slide, okay. But then for the work that I've done so far with gender role measures, right? So we have this issue where we've got these gender role measures that are very, what I would say distal to alcohol use behavior. So I'll give you an example of one. So from the traditional machismo subscale of the traditional machismo and heavy reismo scale from Arciniega in 2008, there's an item that says a man should fight when challenged, you know, so there's like this hyper aggressive kind of component. And so scholars will link that to alcohol use and be like, masculinity is related to alcohol use. Be like, yeah, but what is that? You know what I mean? Like, why is something about fighting related to alcohol use? So if you have more attitudes or beliefs about a real man should drink a lot, right? Not saying that that's somebody saying I drink a lot, but that's they think that that's what men are supposed to do, then we relate that to drinking. And we're finding that those measures are actually a lot better at predicting drinking. And if we're talking about targets for intervention, go right after the alcohol specific gender roles, right, that people are perceiving. So we've got that. And then also I worked on, you know, what I just talked about, the domains, right? Is it the behavior? Is it the belief? So I've got some measures going out with that. And then as part of the KO1, my grant that I have right now, I'm also really interested in the ways that gender roles are perceived in a bicultural or multicultural environment, and then how that relates to behavior. That is sorely missing from the literature. So working on developing some of those measures right now. That's the research side. Okay, not unrelated. But that's a snapshot of all of our activities. We're very, very, very busy in the lab. But here is a snapshot of the funding that I've received. I'm only reporting federal funding. Of course, you know, I've gone after, I've been writing grants for a long time and gone after little pots of money with varying degrees of success. So I'm going to highlight the big wins here. I do want to note that all of these come from the same place for me. So it's the National Institutes of Health, the IC specifically, as the National Institute on Alcohol Abuse and Alcoholism. And so the first bit of funding that I got from them was this F31 pre-doctoral fellowship. And so this is something that I got while I was a doctoral student at UTSA. And so I want to note, because it's relevant for, you know, for folks that work at an R2. At that time, UTSA was an R2. I was the first person in the college to get that mechanism, and that came with some challenges as far as going after it, and then as far as managing it on the back end. So I've been you know, getting new funding at R2 institutions for a while now. So happy to have any conversations about that. But it's great. It's a great source of support. So if you have doctoral students that are conducting health-oriented research, they get 2 to 3 years of support, right? And so they get a stipend that is typically much higher. Believe me, we're not loaded all of a sudden as grad students when we get that, but it's typically higher than what is offered for teaching stipends or GRA lines, right? So it's a little bit higher. They also get several thousands of dollars to put towards conference travel, to put towards, I remember I got a laptop, you know, that was awesome because I could only like afford like the $300 ones before that, which is so much fun when you're trying to run big analyses, you know. So they're able to support you in that way. And they offer, it's a high percentage of a tuition waiver, okay? So these are so beneficial for students. So if you have an opportunity, if you have a student that's highly motivated, let this be on your radar and maybe something that you can point out to them, okay, as an option. This one I'm going to flesh out. I think it's on the next slide. I want to talk a lot more about this one because this is one that a lot of people are not familiar with. And this is probably one of the most transformative programs, I think, that the NIH does. LRP stands for Loan Repayment Program. My particular LRP that I have is for health disparities research. They like a lot of the work that I'm doing, particularly with Hispanic and Latino populations. Okay, and so basically what's happening here is you're in a contract with the NIH to conduct certain types of research or work on a certain program of research. They pay off your student loans while you do it. They provide you student loan relief while you do it. I haven't made a student loan payment in years because the NIH has been paying them for me. And I'm not trying to brag, I'm just trying to show you how good it is. But I think as of right now, they paid off like 85% to almost 90% of my student loans. And I had 10 years of school. 10 years of school as a single mom, right? Like that will rack that up. But yeah, we're gonna go into a little bit of a deeper dive because that's one that I am an ambassador for NIH to talk to people about that. So I'm using this today as a platform for that. And then the one that I currently have right now, that I'm super grateful for, I'm in year 3 of a 5-year KO1 Mentored Career Development Award. And so this is an award to support my continued training and development to become an impactful independent investigator that's conducting research that is consistent with the priorities of the NIH. So they really, all of these are about investing in scientists from the NIH. So, and then as you can see over here on the right, pretty, I've been so lucky to be engaged in a very programmatic line of research since I was a student. I started off in the Latino Health Disparities Research Institute in my undergrad years, and I've never looked back. And so you can see that definitely in the nature of the grants. So yeah, so something I kind of already talked about, but I just kind of want to say, okay, so these are how all of these different mechanisms are similar. So these are all mentored. Every single one of them, even the LRP, given that I just defended my dissertation in 2019, they consider me an early career scholar, and they're like, you're not quite ready for independence yet. We want you to have mentors, who are working with you. So that's, I remember whenever I first was going after those grants, particularly the LRP at Texas State, I was almost a little offended. I was like, I am an assistant professor, but no, I definitely needed the mentorship. So I was really appreciative of that. Something to note though is that they do not support financially the mentors though. So these are mentors doing this essentially for pro bono work. I was just talking earlier about typically mentors are people who are funded by NIH themselves and are therefore very happy to support up and coming NIH researchers, right? So because they're all about your training and development, there's an intensive training plan. I do a lot of workshops, right? I travel to a lot of conferences and do things like that to expand my network and to teach me skills that are going to help me, again, become an even stronger investigator in the future. But there is a heavy research component to all of them. So just as important as the training program, that doesn't mean that we are pulling back on the research. So they're bears to write. They really are. Because you have to have 2 very well-developed aspects, but it's so worth it. And then the difference is the LRP is a contract, not a grant. There are no indirects or anything like that with the LRP. You don't see any of that money. They just make payments to your lender, and you have to verify that every quarter whenever they do that. And then F31 and LRP I can't like pay participants or anything like that. I can with the KO1. There's a research budget there. And then the LRP, I basically just have to write a couple of pages about the activities that I plan on doing over the next couple of years that are within this certain theme of research. Whereas the F31 and KO1, more like traditional research-oriented grants, are focused on specific aims and then the activities that I'm going to do underneath those specific aims. So I wanted to give, if anybody in this room is conducting health-oriented research in any way, or you have students who are going to maybe, defend their dissertations anytime in the near future that are conducting health-oriented research, if you have over $10,000 in student loans, I really just kind of want you to go here, okay, and check this out, okay? So, as I said before, this is a contract between NIH and a researcher, right? Every single institute and center I see for NIH participates in this program. So just because I conduct alcohol research and get my funding from NIAAA, if you conduct research in aging, right? If you conduct research with infectious diseases, if you conduct research, I'm telling you, anything to do with health, mental health at all, there's an IC for you to apply to at NIH. So check it out, okay? And so this is a competitive renewal process. So you go in once, you apply, you get it for 2 years, you reapply, right? So I'm on my 3rd competitive renewal right now, which is why I've almost got them paid off, right? And they'll pay up to $50,000 each year. So of your student loans. this is something I want to highlight that I don't think a lot of people are aware of, even if they're aware of the program. The success rate is bonkers for federal funding. 30 to 56%, depending on the specific concentration or the IC that you're going to. It is so worth your time to try. Right? So the only thing I'll say is that whenever you do apply, if you don't get funded, you never know why. Because it's not like a traditional grant where they sit and there's a panel and you get a bunch of comments, you're just like, oh, I gotta try to figure it out. You can talk, I mean, there are people at NIH that you can talk to try to strengthen your applications. That is a drawback. But for my last slide here, I just kind of want to, across all of the funding that I've gotten, just point out some things that I think for people in this room that are interested in pursuing funding, just to kind of like let it get stuck in your brain a little bit. And again, happy to talk about any of this. Commit to the long game, absolutely. I think about the F-31 I applied for as a student. I mean, it took probably 2 years. I started right when I started the doctoral program, and then I actually even extended my doctoral program a year so that I could have the grant, because it just takes so long to submit the application to get the reviews back. Yeah, that's just a note about procrastination. It will, especially if you know, I've always loved and appreciated being at an R2, like on an R1 trajectory, but we all have to acknowledge some of the hiccups and the glitches that are along the way when it comes to the systems that surround submitting these grants. So they're particularly, like, last minute submissions are particularly dangerous in that specific context, I think. And sometimes just writing the thing is the worst. So just like what I would tell my students, and I don't have anything up here that I wouldn't just remind myself. Like, just if I don't want to write because I'm feeling intimidated or my imposter syndrome is like particularly thick that day, just anything on paper and then start working with it. We talk a lot about this, especially for the mentored components of some of these grants. Whenever you're like, wait, so I have to reach out and ask people to invest all of this time and energy in me, and out of the goodness of their heart, and they don't even know me, which goes along with this right here, right? Yeah, you do, and it's fine. It's fine. It's the way it works, right? But yeah, build teams from fit, not friendship, too. And so that's something as we kind of get on these groups, actually, like what TRC was doing, saying, okay, here are these scholars that we need to get together, you know. And so they identified the strengths and our areas of overlapping, but also like distinct research that would really benefit some of our grant applications. And then also, don't be afraid to reach out to folks at the NIH. So the program official for whatever you're going after, that can become your friend. And then to become a reviewer. They have an early career reviewer program. And so you can go and you can see how it's done. You can read successful grants. And I think that that's actually one of the most instructive aspects of this. How are we doing on time? How long did I go? We're good? Do we have time for a few minutes of questions in case anybody has some for me before?
Yes, we can wait till the end, however you want to do it.
Does anybody have any, like, while this is all fresh, does anybody have any questions now? And then we can also do it at the end if you want to let them kind of marinate a little bit. Yeah.
What was unexpected when you applied for the LRP? And I say that because obviously applying for a research grant is one whole different aspect to then you're like, I've got to bring in student loan data and commit in a different way. And I'm saying this is one of the people who is in staff role who wants to then figure out, oh, this is a new type of opportunity. How do we make this work?
Yeah, so it's I think that the thing, well, I'll tell you what a challenge was that I was not anticipating is they require a certain amount of time throughout the year to be protected for research. I cannot remember what that percentage is off the top of my head.
6 months, I think.
So for some, yes, you looked into it. So for faculty teaching on a 3-3, that could be a challenge. But what we did, so we were honest, right? But what we could do then is say, okay, well, the way that it was worded, you could talk about your average across the whole year, right? Not including like summer. And so we were able to make it work like that because contractually I was obligated to teach a 3-3. So that was, I would say that was something that I wasn't anticipating. And when it came time to get all of the signatures on that, that was something my chair was like, okay, we need to figure out this. So there was a workaround for it though. And for me, I remember it was difficult to, from the point of the applicant, all the level of detail they wanted about all the student loans that I already had was extremely tedious, extremely tedious, but worth it, not complaining at all.
And that was something too that you had to like coordinate internally with your chair and
Yes.
upper administration, but you just submitted that on your own.
That was something I
It's not
submitted,
one-
yeah, I
it's
didn't
not
have to go
something
through
that
the process.
routes through the universe.
Yes,
Yeah.
but I had to get, you have to get,
And
you know,
just
getting the
go live.
getting the
Yeah.
blessing of your chair and folks on the inside first. And especially because it's not, I mean, it is something that is to benefit me, right? My department did not get any money from that. But, you know,
Thank you.
thank goodness they didn't mind.
I would love it if our research coordinators and or our PhD program directors would get involved and think about these things from the beginning and build it into programs, awards that are possible and learning that's possible and build it in as part of the process to, you know, recruit people and things like that. So thank you for that.
Yeah.
So the word translational and translational health research, it kind of speaks to the difference between these two styles of research because I started out much more in the realm of what Jessica does, which was usually ending in a journal article, which is great. But then I started getting Samson grants and I realized that, you know, they had a total disassociation from the literature and the evidence-based practices that they would ask you to employ in your studies. And it was maddening to me. And what I realized was there is no funding source that says connect the dots. So that's what we're really hoping to do here is to build programs of research that cut across evidence from research in a journal or wherever, but then making sure that it actually reaches the people that can use it, to groups, the people that do interventions, and the people that they serve through their interventions. And so making sure that that trajectory isn't just assumed. Because I don't know about y'all, but you know, journal articles behind a paywall are not always built for the minute that you're trying to deliver something to a particular audience. So our process of putting that together is the way that we use the word translational. Other places it's called bench to bedside in the healthcare context, but we think about it in the trajectory of research, like a systems perspective. So our next speaker, Clary, comes from the School of Social Work, and she, as I kind of alluded to, does more applied work that we're hoping will, by putting together this magic, we can help make possible the opportunity for people that are good scholars to work together without any obligation to do so, but to say, how do we make these things inform each other in ways that are going to make us better as a university and our research better, because we're actually doing that translation here, because there's no funding agency that does it. So,
Thank you.
sure.
Right, I don't know how I'm gonna follow after Jessica. But hello, everyone. I am Kelly Clary. I am a 5th year assistant professor in the School of Social Work, currently under review for tenure. So I am a social worker. So prior to coming to Texas State University, me and my husband lived in Illinois. And I was a social worker at an inpatient psychiatric hospital. I worked in an outpatient substance use facility. I was a crisis social worker at an emergency department. So with that clinical work, that experience, I really wanted to make sure that the research that I was doing was also similar in regards to being in the community. And I think as a social worker, you want to be with people as much as possible. So hopefully you can see that thread throughout what I talk about over the next 20 minutes or so. So regarding my research agenda, I would say overall, I'm really looking to improve and support the well-being of marginalized populations. But that thread based on my clinical experiences really includes mental health and substance use. So I'm looking at developmental and cultural factors that influence high-risk substance use behaviors. And then that applied work is then thinking about how we can utilize this information to measure those behaviors, those outcomes, and then also think about interventions, outreach, programming to again have that impact with our communities. A lot of the work that I have been doing has been with emerging adults, so 18 to 29-year-olds, military members and veterans, as well as LGBTQIA+ persons. So just a few studies that I can briefly talk about before I go into my federal funding track. We just completed a photo voice study with student veterans here at Texas State, and we were asking them about their well-being whether that's positive, negative, how that relates to them being, you know, a student, veteran here at Texas State. So we asked them to take pictures in their various environments when they thought about positive or negative well-being. And we had over 100 images, and we qualitatively analyzed that. I will mention this later on, but qualitative work is a lot of work. Photo voice methods is like double that. So something to be mindful of when we think about the research that we're doing. But again, that was very applied when we think about like asking them to go into their various communities and take images based on their feelings. I also did some work in Illinois with older veterans, and we completed interviews with 30 older veterans. They were 60 and older, and we asked them about their medical cannabis use and how that impacts their opioid and benzodiazepine use. That is work that I wanted to move into Texas, but if we think about those laws in Texas regarding cannabis, medical cannabis, they look very different than Illinois, where cannabis is legal recreational. And then I just finished an American Psychological Foundation study, which was a photo voice study that informed art exhibits. So we asked LGBTQ+ individuals in Central Texas to take pictures in their environments regarding their various identities. We then printed those images and had pop-up art exhibits throughout Austin, San Marcos, and San Antonio. And the idea was to reduce stigma about these intersecting identities. I mentioned photo voice was a lot of work. Add on an art exhibit, that was even more work. But we were in the community and really working with community partners, which was great. So a little bit about the well-being of marginalized populations that I have supported with various grant mechanisms. So one piece of feedback, advice that I was given by a mentor, was to really have a research philosophy in the sense of like, how do you set yourself aside, apart from other researchers? And my philosophy and what I really try to exemplify in all of my grant proposals and all of my projects is this research with and research for. So I'm doing research with those participants and I'm doing it for them. And I think that is one thing that I always go back to when I think about the mechanisms that I'm applying for, to make sure that our values fit in regards to that mechanism and what I'm able to do if I am funded through them. So research with and research for, I would say this really I have to capitalize on when I work with military members and veterans, to know that I am supporting them. They are not just a number to my research, but we are in this together. So I just wanted to really capitalize on that, because I hope that when people think about the research that I do, or they see my name, they really do understand and see my value in doing research with and research for my participants. So I currently have 3 federal funded grants that I am either leading or co-leading. So I will briefly talk about those 3, and then on the next slide, I'll go into a little bit more detail about that 3rd one. So the first one is an RO3. An RO3 through NIH is a mechanism. It's 2 years, $100,000. It's not a lot of money, but it is something. I am a co-I on this proposal, and the University of Illinois at Urbana-Champaign is the PI. I mentioned that because if you all remember, I'm from Illinois, so I'm still doing work with people at Illinois. So this project, we are in the 2nd year. It will conclude in September. RO3s, again, it's a short time period, not a lot of money. A lot of that work is secondary data analysis. This project is really utilizing a huge meta-analysis with over 2,000 articles, using machine learning algorithms to think about protective factors, high-risk factors that relate to military suicide. So we are finishing up annotating over 2,000 articles right now. And the idea of an RO3 is then you lay this framework, you have this data to then apply for future NIH mechanisms. The next one that I'll talk about is through the U.S. Department of Veterans Affairs. That makes sense, hopefully, right? Because I do work with military members and veterans. This is a $344,000 grant for 1 year. So that's a lot of money for 1 year. I am serving as the co-principal investigator with Dr. Catherine Selver, who's also in the School of Social Work. We do a lot of work with veterans together. So we were awarded this in September. So we are almost halfway through. This is titled Tech Vet Legacy for Tomorrow. So our goal is to train 12 students. We have funding to hire 12 students with the priority of being student veterans and military connected. To date, we've hired 11 at Texas State, which I think is really exciting. And again, goes back to doing research with and research for. So we are training those students to collect stories of veterans who have been interred in a VA-funded cemetery in the state of Texas. 50 stories, and this is a really unique grant mechanism through the Veterans Legacy Memorial. It's an online repository of veterans who have passed away, and you get to learn more about them. This grant is a collaboration with the School of Social Work and also LCAC 1 in the library, where we are learning all about innovative technology. We've got equipment to collect those stories. So it's a really fun grant. It's hands-on. We just had a visit to Killeen, Texas on Monday to visit the cemetery and to learn more about behind the scenes. With this grant, since it is 1 year, it moves very fast, but there is kind of a high likelihood of being refunded if you do apply again. So we'll be applying for that again in April. I do have to note this grant holds a special place in my heart, not only because it is research with and for veterans, but I did submit it 2 days before giving birth. So that was one thing. Thank you to Alyssa for all of that help. So with that, I'll talk about this later on, but this collaboration piece. So that well-being photo voice study that I talked about earlier, that was a presentation poster at the Translational Health Conference that happened 2 years ago in the spring. And that is where we connected with Dr. Coy Wynn in LCAC 1 to talk about this grant. So that was a great networking opportunity. So again, I'll encourage that networking later on, but this is how that collaboration came to be. And I don't think it would have happened if we did not connect at that conference. The next one is the most recent, which is a 5-year SAMHSA grant, almost $1.9 million. I am serving as the PI of that. I also have Dr. Megan Rogers, who's serving as a data analyst, faculty fellow, Dr. Ty Shepis, who's also a faculty fellow, and Dr. Erica Nason, who's also a faculty fellow. That is our team. This is supporting Hayes County regarding fentanyl education, support, training, awareness. If you've read the news, seen billboards, watched TV, the news, you've seen that accidental fentanyl overdoses are happening in our community. They're happening across the country, but specifically in Hayes County. So this is in response to Tucker's Law. If anybody's familiar with Tucker's Law, it requires 6th through 12th grade schools in the state of Texas to implement curriculum regarding mental health, suicide, and fentanyl. So we have partnered with Wimberley ISD, Dripping Springs ISD. Fingers crossed, we're hoping to get Hayes and San Marcos on board soon to deliver outreach, to deliver presentations, which is again that applied in the community work. This just started September 30th. I feel like we've been working on it forever because it's a lot of work, but it's also a lot of fun. So a little bit more about that grant. This is, it involves many parts. There's a needs assessment, which I think community partners enjoy that because you're able to give them data and you're doing the hard work. you're aggregating the data, you're giving them presentations, and then they can also inform other programming, which I think is really important. We are creating and implementing outreach, education, workshops, trainings, really asking our partners, what do they want? And how can we make that happen? So this grant involves a lot of meetings, a lot of brainstorming, which again, might be a little bit different than what you are doing in your lab with data analysis and that type of work. Hiring a licensed chemical dependency counselor. So again, we're hiring a part-time LCDC to be in the schools. And we're going to be evaluating the work that they're doing and the impact that they're having, which can inform future grant funding so that at the end of the 5 years, we're not just like, hey, this is over, right? We want to leave them with something or continue in another funding stream. Community Advisory Board. So we have partnered with Texas Icon, Senecor, Hill Country MHGD, and the Hays County Sheriff's Office. So we have 4 members of our Community Advisory Board that meets with us monthly to provide us feedback. We give them an update on where we're at, and then it just really helps us to increase that collaboration, build that rapport, that trust. So if something does come up, we have somebody to fall back on. We can give our partners, Wimberley and Dripping Springs, these resources, right? I think this is just laying the foundation to then implement some of those trainings and workshops. And then quality improvement surveys and interviews to inform us of like, what do you all like? What don't you like? How can we change things? So I think with this project, we submitted what we plan to do. We have our objectives, we have our goals, but I really went into this knowing that those things might change based on the needs of our partners. And sometimes as a type A person, that can be hard to adjust and modify, but that really is where that collaboration is so important, right? That reciprocal relationship that you're having with community partners. So I mentioned 3 different federally funded projects. All are from 3 different funding organizations, agencies, U.S. Department of Veterans Affairs, SAMHSA, and NIH. However, when I look back on the research that I had funded, there are 3 things that are consistent throughout those funding, those proposals. So the first one is the qualitative component, the second one is the community advisory board, and the third one is that community-based research. So I'll talk a little bit more about those on the next few slides. So the first one, that qualitative methods, knowing that it is complementary to quantitative, it is a lot of work, a lot of time, a lot of effort, a lot of resources go into it. So that is something that definitely has to be worked in when we think about like graduate research assistants, transcriptions, paying our participants for giving us their time. But there's different ways that we can do that. Open-ended questions on surveys, doing interviews, doing focus groups, using photo voice methods. There's a lot of different ways. But I think when we think about being culturally responsive and informed, giving our participants the opportunity to share their experiences by voicing their concerns, voicing the things that they want to see change in their community. Qualitative is one of the, I think personally, the best ways to do that, which makes all that extra work and time worth it in the end. Community Advisory Board. So the way that I've utilized community advisory boards is we have monthly meetings. We record them, we take notes. It gives our community partners a voice. It helps build rapport and trust. They're able to give us feedback on all of our materials. It's that direct connection to the community. And it's also an opportunity for them, if they trust me as the project director, and they have, some type of funding mechanism that comes up that is similar, they may think of me as like, how can we get Kelly involved in this? How can we get Kelly's team involved in this? So it really is important, I think, to have those connections with the community. We offer them an annual stipend. And then I think it's really important to secure them while writing the grant. I've done both. And I think the most successful has been securing those partners while writing the grant, getting those letters of commitment, that buy-in up front rather than having to potentially scramble to get somebody involved. So the VA grant that we have, we did not name participants who are going to be on our community advisory board. And it's worked out perfectly fine. The SAMHSA grant, we did have people written in and it's worked out really great. My American Psychological Foundation grant that we had a community advisory board, we didn't write people in and that kind of failed. So again, I would strongly encourage to have them written in because I think it strengthens the grant. It shows that you have commitment, and then you have that accountability for those partners as you move forward. And then the community-based research. So really seeing this as a mutually beneficial relationship to those partners that are grounded in scholarship. So when you think about SAMHSA, that evidence-based interventions, right? We can't just do whatever our partners ask us to do, right? It has to go back to that mechanism of, are we actually doing things that are evidence-based? They're not going to do more harm than good, right? Those types of things. But I'm asking our partners what they want to see so that we can align with what we're doing to meet their needs. Going out into the community. The meetings that I was having while writing this SAMHSA grant, I was going to those school districts. I was having meetings with superintendents. I had to present at the school board. So this takes a lot of time, a lot of effort. But in the long run, I think it's worth it. What does the community need? What does the grant require? Sometimes trying to make those match can be challenging, but for that long-term commitment with the partners, if you're giving them what they're wanting or what they're needing, I think the likelihood of them staying on board and working with you is very likely. So some examples of how we ask the community, those partners, what they wanted or needed. Survey questions, going to events, showing your face at trainings or workshops so that they don't just see your name. And then being open to modifying those objectives. So for example, we've had 2 Narcan trainings, one at Wimberley ISD and one at Dripping Springs ISD over the past 2 months. And I made sure to go to those. They were, in the evening, but I made time to go to them so I could see who was participating. They could see my commitment and my passion for the project that I'm doing. So my goal in doing that is they're going to trust me. And then when I'm asking them to do a needs assessment or I'm asking them to share the word about this project with, their neighbors, they're going to be more likely to do that. So my funding journey, these are some prompts that Jessica had asked. So thinking about the right fit. Hopefully you can see that, when I think about working with veterans, like the Department of Veterans Affairs is probably a good mechanism. Substance use, mental health, SAMHSA. I've learned that NIH might not want to fund a lot of veteran research because they're going to say, look at the DoD, look at Veterans Affairs, right? It doesn't mean that they're going to say absolutely not, but it might be a little bit harder for me to actually get funded for a veterans grant with NIH. So just some things to be mindful of in regards to what they actually have funded and are likely to fund. Connecting with scholars who have been funded by the agency. So I'll mention this later on, but seeing a successful proposal is a game changer. Seeing what has been funded in regards to their formatting, things that they include or not include is a game changer. So I was thankful enough to have partners at UT Health Houston who provided me with examples for SAMHSA. And I can credit them a lot because we were funded on the first submission in February. Networks and collaborators, I've mentioned this before, that networking, that collaboration, making sure you have those, but also being very strategic. Where do they fit to elevate the proposal? We shouldn't just be throwing people in because, again, they're our friends or because it sounds good. It should actually make sense to put them into their proposal. And then really thinking about your proposal at the end. Does it convince reviewers that you will accomplish your project? So we're thinking about partners and collaborators. Does it add to it, or does it seem like you're going through the weeds with it, right? So it needs to be as concise, straightforward, and it's convincing that they will actually help you. So the last 2 slides that I have, lessons learned. Publications are your currency. So not having grants yet, like thinking about publishing so that you have something to show that you're an expert in this area, right? You're an expert, you have experiences working with this population. Smaller grants matter. Smaller grants matter. So thinking about the REP, Dr. Rogers and I were fun to do the REP 2 years ago. The MERG, when that was the thing, Accelerator, foundation grants, American Psychological Foundation, all of those things add to your resume and show that you can accomplish and you can be successful in a project. Collaborations, networking is so important. Meet your colleagues. One of the first things that I did when I became an assistant professor here was have a meeting with every single faculty and staff in the School of Social Work. It came during 2020, so all of those were new meetings. But it was the best thing ever because I could see what other people are doing. When I thought about who I needed to connect with in the community, I could go back to those conversations and ask for a warm handoff to connect me with them. Network to ask for successful proposal examples, being strategic, avoiding the reviewer having questions. So that is where, asking others for their time to review your proposal and give you feedback. Because when you're so in the weeds of it, you might miss things that somebody else might be able to bring to life. Capitalizing on leadership and execution of projects. So when I wrote the SAMHSA proposal, one thing that I thought back to was work that I had done in graduate school, where I was, a co-leader of implementing over 9,000 students going through a substance use prevention program. Do you see how that aligns with the SAMHSA grant? So even though that was years ago, it was still something that related to the SAMHSA proposal and what I was planning to do with the project. So being strategic and thinking back to things that you have done that would show your leadership and the success that you've had in other projects, even if they were smaller. So moving forward, I encourage you to consider some of these things and integrate them into your work, using qualitative methods to complement your quantitative research questions. If you're not a qualitative person, think about somebody who is a qualitative person who can bring that expertise to the table. Networking, warm handoffs to potential stakeholders, collaborators. So for example, I'm trying to work on getting San Marcos ISD on my SAMHSA grant. I do not want to just cold call San Marcos ISD. So I'm thinking about who I know in my network that has a connection. And upon, talking about this, I know somebody who knows somebody who's on the school board. So they're going to help me that way. So being strategic about that. And that's one thing that I've had to learn of, like, I want to do things very, very quickly. And sometimes I have to step back and think about, is that the most strategic, efficient way I can do it? Or will I be more successful if I do it a different way and just slow down a little bit? Meeting partners in the community, going to them. I would never ask one of my collaborators to come to campus and have to find parking. So like thinking about those things, like making it easy for your partners. So like, let's go meet for coffee and have this conversation rather than asking them to park at LBJ, right? Just being like very mindful of those different hurdles because you want to make it as easy as possible for your partners to be like, yeah, I want to work with them because they're going to be mindful of my needs. Securing letters of support commitment for your community advisory board. What's in it for them? Not only a stipend, but like what else are they going to get out of it? So for the school board, we propose that, our quarterly reports, we're going to write them up and provide them back to the school district. So again, they have data that can inform other programs. And then make it make sense, being strategic with all their research team members and community advisory board members. I'm all about being productive and efficient and being strategic in the work that I do. So hopefully y'all can see that thread throughout all of what I've talked about.